Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer Show. I'm Dr. Amy, a fertility expert in California, and the topic is everything you need to know about the most up-to-date fertility care. No matter where you live, I hope this show will help you. In this picture, you can see a woman. She has shoulder pain. And what happens when you have shoulder pain? Go to the doctor. The doctor will run some tests, tell you what's going on, and tell you how to fix it. What the doctor won't do is tell you to come back in a year for treatment. That's ridiculous. You don't wait for treatment for shoulder pain. You shouldn't wait for treatment for infertility. And why do we do this? It's because we don't think of infertility as a disease. We think of it with religious and cultural undertones, and everyone has an opinion about your infertility. Your mom, your mother-in-law, your friends, your neighbors. Fertility doctors are here to help you. We have new and better diagnostic tests, and we have treatments that work. There's no better time to be a fertility patient than now. If you're seeking treatment or just want to ask questions about your fertility, that doesn't mean by asking questions that you have to do treatment. Asking questions can just guide you that you're doing all the right things at home. So let's talk about how we use the latest technology to help patients have the highest chance for pregnancy. We do a tube test. This is called the hysterosalpingogram. We do an ultrasound to look at the uterus and ovaries. This is called the pelvic ultrasound. We look at sperm. You can do it in the andrology lab, or you can do it at home now. There's a do-it-yourself test called the Yo Sperm test. We check hormones. We look at preconception labs, infectious disease labs. We do that around cycle day number 3. We also look at genetic tests. Chromosome analysis, for example, is one of them. A carrier screen. Sometimes we do a cancer screen, and we look at fertility genes as well. That's called the phosphorus test. You put this all together in 1 month. The semen analysis can be done anytime. Day 3, your period starts, and you do the blood test. At the same time, you can do an ultrasound. HSG is done cycle days 8 through 10. Day 20, you have all the results back in 1 month. You can get a complete fertility diagnostic evaluation and results back and a treatment plan. And you're never going to be that patient that tells me, Dr. Amy, I went to my OBGYN and I asked for a semen analysis and she told me I had to wait 1 year before she would do it for me. That time is over. Totally gone. We put this all together. It's called the TUSHY Method. Send your OBGYN my link, tushymethod.com. Talk to your friends about it, tushymethod.com. You get my point. And this is a new era. We're living in a time where we problem solve. We want to identify the problem, fix it, and treat it. And blaming women for fertility issues is a thing of the past. You've heard the saying, it takes 2 to tango, and it certainly does, especially when it comes to a healthy pregnancy. We know from studies that sperm counts have gone down tremendously, over 50% in the last 40 years. So if you're someone who's done the sperm testing and find that the sperm counts are lower in your situation, I want to teach you about all the things that you should know. This is what I tell my patients. Look at background genetics. We talked about the genetic tests in the TUSHY method, but for guys, if the sperm count is low, you can do a Y chromosome microdeletion test, chromosome analysis, sperm DNA fragmentation test, and certainly see a male fertility specialist, and they'll see what other tests should be done for you. Think about anatomy, undescended testicles, a history of that, or surgery in the testicle area, or a varicocele. A varicocele is a dilated vein around the testicle. And a lot of guys who have a lower sperm count might be diagnosed with that, and talk to your doctor about whether it should be removed before you start planning your treatment if it's going to be a big deal. And lifestyle, super important to talk about. Don't use hot tubs, saunas, steam rooms, or bubble baths. I just came up with that. I think that's pretty funny. Drink alcohol in moderation. And of course, the medications that you're taking. Talk to your doctor about your meds. See if any of them are like a version of birth control for men. For example, a calcium channel blocker. Did you know that that can actually inhibit fertilization? And testosterone. There are guys out there that are juicing at the gym. Testosterone can kill sperm. So talk to your doctor about the lifestyle that you're leading. Ask them if your BMI is too high, and do get into the best shape of your life. so that you make the eggs look really, really good. And when it comes to labs for guys, we check FSH, estradiol for guys too, thyroid, prolactin, hemoglobin A1C even, and testosterone levels. A low testosterone can sometimes be the reason for a low sperm count, and certainly getting those labs checked can help you figure out what you can do that's in your control to make things even better. And the last thing to think about when thinking about a low sperm count is if there's any sexual dysfunction or a low sex drive. If a guy doesn't feel comfortable enough talking to me about that and doesn't want to open up so that I can help with a prescription, for example, for Cialis or Viagra, seeing a sex therapist or, again, a urologist, that can sometimes help. So talking about sex is something that we do, and I put this all together in an easy to remember mnemonic called the BALLS method: background genetics, anatomy, lifestyle, labs, and sex. These are the 5 things that I talk to the guys in my office about if the sperm counts are low, and I hope that this will help you so you're not feeling confused or lost or think that things are more complicated than they really should be. And now that you know what elements we use for a proper diagnosis, then you're ready to plan your IVF cycle if that's the technology that you're going to be using to get pregnant. With IVF, we have options, 3 of them: transfer fresh 5 days after the egg retrieval, transfer frozen, or transfer frozen with genetic testing. On this picture here, this is a picture of genetic testing, also known as PGT-A. With PGT, we can look at chromosomes of embryos, and studies have shown that this might give patients a higher chance for a healthy pregnancy, lower risk of miscarriage. It's the murkiest crystal ball, but it's the best that we have. It only looks at chromosomes and doesn't look at all the genetics of your future pregnancy. Then we look at the testing of the lining of the uterus, and we have options for endometrial testing, and that's a test called the Receptiva test and the ERA test. I do both. I look at the BCL6 score, and that guides me as to what protocol would be best for my patients and whether certain treatments would be better before we transfer. And I also look at the ERA test that tells me the number of hours of progesterone that my patients need before she transfers. The way I do these tests, and certainly your doctor will have their own way, I put my patients on the same cycle of meds that they would for a transfer, but instead of transferring, I do something called an endometrial biopsy with pain meds, of course, or under anesthesia. And sometimes I do it at the same time as a hysteroscopy as well. And then we go ahead and transfer. And we put that together, and that's called the Egg Whisperer Diet. Diagnosis through TUSHY Method and the BALLS method, IVF, endometrial testing, then transfer. So these are the elements that I talk to my patients about, and certainly I try and be as realistic as possible about chances. I try to give my patients as much support as they could possibly get, but I also think that every patient needs their fertility team. The first part of the team is therapy. If you don't have a local therapist that you're working with already, talk to your doctor about referrals, either over the phone or in person, and you can also use technology like Talkspace.com. Easy to go to, easy to find. Exercise is still super important. Talk to your doctor about their exercise recommendations for you and your body. Acupuncturists can help minimize the symptoms of being a fertility patient. You know, all that pain, bloating, and nausea that some patients feel? My patients who do acupuncture feel so much better during treatment and in early pregnancy. And meditation is super important to consider doing. If you're feeling those racing thoughts and can't focus, consider using a meditation app like Calm.com. There are so many other apps out there. Better diagnosis means less time wasted on treatments that don't work. I'm going to say that again because I think that's so important. Better diagnosis means less wasted time on treatments that don't work. I never want to hear a patient say that she did 10 IUIs before she found out that her fallopian tubes weren't open. Consider doing these tests up front. Fertility doctors, we're only human. We can't put Botox in ovaries. We can't help women grow more eggs once they've run out. All we can do is give you the best chance of pregnancy using the best technology we have, and sometimes the best technology is still considered a murky crystal ball. So do diagnosis before treatment, and that's why I came up with the TUSHY Method and BALLS method, as well as the Egg Whisperer Diet, supporting you with your fertility team. And what I call this is the Egg Whisperer Plan. So I hope that these elements will help you no matter where you are, no matter who your doctor is, so that you can use this as a checklist for your own care so that you have the best chance for pregnancy. I want you to have access to the latest technology that science has to offer so that you can achieve your fertility goals in the quickest, most efficient way possible. I want you to spend less time as a fertility patient and more time as a parent. I hope you guys enjoyed tonight's show, and I look forward to seeing you next week. Please join me. Have a great night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.